A school nurse's quick guide video. Whether it's a slip on the playground or a misstep in PE class, visits to the school nurse for sprained ankles are common. A sprained ankle occurs when ligaments in the ankle are stretched or torn from a sudden movement or twist. Over 85% of ankle sprains result from the foot rolling inward and leading to pain and swelling to the outside of the ankle. With over a quarter of all sports-related injuries in children involving the ankle, it is important for school nurses to perform a thorough assessment and recognize signs and symptoms of a sprain versus a fracture. A sprain typically involves mild to moderate pain and swelling, but the student will have the ability to bear at least some weight, either immediately following the injury or after a short rest. Fracture should be suspected if the pain is severe, the swelling and bruising are immediate, the student is unable to bear any weight, or if there is a deformity or bony tenderness on palpation. A school nurse's evaluation of a sprained ankle should include a detailed history, as well as a physical assessment. Knowing the mechanism of injury can help guide the assessment, since most ankle sprains are caused by the foot rolling inward and with damage to the lateral ligaments of the ankle. If another mechanism of injury is reported, it should raise suspicion for fracture or other musculoskeletal injuries. Determining when the injury occurred allows for accurate assessment of onset and severity of symptoms, and asking about previous ankle injuries can provide valuable insight, since the only known predictor of an ankle sprain is a previous ankle sprain. And did the student hear or feel a pop? This can, at times, point to a more severe injury. Physical assessment considerations include the student's ability to bear weight, potential nerve involvement, any gross deformities or abnormalities, range of motion, and point tenderness. Treatment of ankle sprain should follow the principles of RICE: rest, ice, compression, and elevation. The injured ankle should be rested and elevated as much as possible for the first 24 hours. After that, activity that doesn't cause pain can be slowly resumed. A cold pack can be applied for 20 minutes up to 4 times the day of the injury, and then as needed thereafter. An ACE wrap or compression bandage can help reduce swelling and provide support. Always wrap distal to proximal and ensure a snug, not tight fit. Lastly, when permitted and appropriately ordered, acetaminophen or ibuprofen can be given as directed for pain relief. Referral for emergent or more urgent care may be indicated for more severe ankle injuries or when a fracture is suspected. Further evaluation is necessary anytime there is severe pain or the pain and swelling persist with no improvement after a few days, and anytime a student is unable to or refuses to bear any weight on the affected ankle. Now that you have an ankle sprain assessment strategy, stock your school health office with all the supplies you'll need from McGill School Nurse Supplies. Brought to you by your friends at McGill.